My name is Dr. David Benversi, and I'd like to share with you the most effective ways that I've found with trying to relieve the pain or the symptoms associated with a disc bulge or a disc herniation. Now there's three main therapies that we use in our office, and each one of them by itself is very effective in helping reduce the pain associated with a disc bulge or a disc herniation. But when we use all three of those in combination, it is extremely effective in helping out with this disc bulge and disc herniation. Those three therapies are the chiropractic adjustment, electrical muscle stim, and also traction. The chiropractic adjustment helps out in three main ways. The first thing that it's helping out with is it's going to be working with the disc herniation itself, as far as trying to reposition that disc and making sure that there's enough room for that disc to function and do what it needs to in that area. The next thing that the chiropractic adjustment is going to do is going to reduce the amount of inflammation and also reduce the amount of pain that's associated with that disc herniation or disc bulge. Now, with regards to the electrical muscle stimulation, when we place, basically we would place two pads in that, or a couple pads in that area of your back or neck, and apply a mild electrical pulsating current through that area, and it does three main things when we're looking at helping out with that. It reduces the amount of pain, it reduces the muscle spasm or the muscle tightness, and it also reduces the inflammation. Now, the first thing as far as reducing the muscle pain, or the pain, excuse me, is the electrical stimulation actually acts as like a nerve block to those nerves in that area. So it's going to reduce the amount of pain that those nerves are even able to transmit out of that area. The second thing it does is it reduces the muscle tension in that area. And if you can imagine, the muscles in that area is more or less being a compressing factor in that area. So if those muscles are relaxed, they're not going to be pressing down or pushing on that disc or disc herniation as much as they were before. And lastly, helping out with the decrease in inflammation with the pulsing factor of the electrical muscle stimulation, it actually works as a mechanical system where it helps to pump out some of the inflammation in that area, which is one of the main contributing factors when we're looking at the pain associated with a disc bulge or a disc herniation. And lastly, we're going to be looking at traction, and that's going to help out in two main factors. The first main factor that it's going to be helping out with is when we're looking at the disc bulge or disc herniation, we have the bones that are basically on top and below that disc, and with the traction it's going to actually help disassociate or bring those bones apart so that that disc has more room to be able to function and in effect cause less pain in that area. And lastly, it's going with that traction, it's also going to allow that disc to apply pressure to that disc specifically and allow that disc to normally function better than what it was beforehand. Now, with our patients in our office, when we start providing treatment for them, they typically note that they have relief from a couple different things. First thing is they have a relief from the pain that they're experiencing. Secondly, they have a relief from the decreased range of motion that they're experiencing. And lastly, they're going to tell us about the decrease in the muscle spasm or the muscle tightness in that area as well. Now, with disc herniations and disc bulges, a lot of times our patients are telling us how they're able to work and function a lot better at work throughout the day. They're able to stand for longer periods of time or sit for longer periods of time, depending on what type of job that they're doing throughout the day, and they're able to have a better attitude about their job. And the next thing that they typically will tell us about is how their activities of daily living are much easier for them to complete and not have any pain when they're doing those things, such as grooming themselves, getting a shower, putting clothes on throughout the day, tying their shoes, simple things like that. And lastly, typically patients will tell us how they're able to sleep and they're not in pain when they're trying to sleep at night. So that allows them to increase their ability to fall asleep, their ability to stay asleep, and the quality of the sleep that they're able to achieve throughout the night. And lastly, and most importantly, what we find in the office is that we notice a huge reduction in the amount of surgeries that are actually performed on our patients if they come to us and have us treat them in our office for those disc bulge and disc herniations. So if you're in pain, we'd love to help you. Please give us our office a call at 618-519-9334.